overworked and overwhelmed, a common sentiment inside UK hospitals.
I was on Christmas Day and it was wall-to-wall COVID. So we see patients who are coming in who have COVID symptoms, but we also see other patients coming in with other problems who turn out to be COVID positive.
People are just beginning to be exhausted. It's been such a long year.
Today, a record-breaking 53,000 new COVID cases were confirmed, and the number of people hospitalized now higher than during the peak of the first wave. Outside one hospital, there were so many ambulances lined up, some were forced to park illegally.
We will continue to do all that we can to keep everyone safe and make sure that everyone is cared for. But I do think that if we continue with the current rate of admissions, we are very, very close to becoming overwhelmed.
Today, while visiting a vaccination centre, the head of the UK's National Health Service acknowledged the toll it's taking on staff.
A lot of people are understandably feeling anxious, frustrated and tired. And now, of course, again, we're back in the eye of the storm with this second wave of coronavirus.
That storm, a surge in positivity rates. A recently released figure showed there were more than 645,000 cases of COVID in England. That equates to 1 in 85 people with the infection. Today, a warning that things could get catastrophic if nothing changes.
If we don't introduce tougher restrictions in areas in the north and areas that are not currently in Tier 4, they will rise to very high levels of disease and hospitalizations.
Around 24 million people here in England are already living in Tier 4, the highest level of restrictions. The government now has to decide whether that is enough. The Health Secretary is set to address this tomorrow in the House of Commons. Farah Morali, CBC News, London.